I think there's a lot of people out there that have seen what can happen, especially, with a crisis like COVID. I think the risk though is that we end up going back to do things that are fall back in because it takes a lot to make those system-wide changes, and some risk has to be involved in that, which is tough in our line of work. And as you would know, it's like risk tolerance is like, okay, zero risk. That's hard to innovate and implement new things if that's the way that our system is used to thinking. But I think we're at a bigger risk if we don't do that, just given all the challenges that we're currently facing.
It's weird to think, like, just hearing you say that in my head, I'm like, yeah, why is healthcare so risk averse? But then anytime you think about medications and pharmaceuticals, there's 100 different risks listed that you have to cover with the patient and make sure that
Yeah.
everyone's informed and making a good decision there. But like when it comes to tools, computer stuff, technology, data privacy, suddenly everyone is very, very, very risk averse.
Yeah. I don't know. I mean, I think it's just more of like everyone says, like a people problem, right? It's sometimes easier to identify those things and the reasons why we shouldn't do something as opposed to why we should. It's easy for me to say I'm not a clinician. I don't see patients. Everything we're doing is hopefully enabling, that patient provider experience. You would probably have, different thoughts on why that risk tolerance needs to be, at a certain level versus someone like me that's outside of the exam room. But I think there has to be more of a happy medium to get us there.
Well, it's just now that I'm thinking about it, right? Like you're in the pre-operative anesthesia clinic and you're going through the checklist in the algorithm with the patient. So you're like, yeah, there's like a 2% chance of death if you go through with this procedure, right? Like it's low, but it's not zero. But then when it
Sure.
comes to the, AI and scribes and stuff, like, okay, well, what if somebody got a transcription of this call? And that's just like, okay, this
Yeah,
is an
right.
absolute no-go zone. Like that cannot happen. But the 2% chance you die getting your hip fixed or whatever was going on, like that's seen as the acceptable line.